I think we're often scared of what we don't understand. So I would say if you are super concerned about AI in dentistry, educate yourself. So finding out what is going to be the standard and needed to be compliant with the EU AI Act, and then finding tools that are aligned with that. You don't want to be the guy who's using the flip phone when everyone's using the iPhone.
Most dentists aren't trained to run businesses, let alone scale them. This is the TechDental Podcast for dental leaders who want more than just tips. We give you systems, strategies, and straight answers. I'm Dr. Randeep, and each week I sit down with the operators, AI founders, entrepreneurs, and business leaders who are reshaping what's possible in dentistry. If you want a smarter, scalable, future-proof practice, then this is the podcast for you. Welcome back to the TechDental Podcast, the show where we explore how AI and emerging technologies are disrupting and reshaping the business of dentistry. I'm your host, Dr. Randeep, and today we're diving into a conversation that sits right at the intersection of technology, trust, and transformation. We will explore how AI is redefining the relationship between dentists and their patients, as well as acting as the dentist's assistant and co-pilot in diagnosis. Today, we are lucky enough to be joined by two fantastic guests from Pearl AI, a company recognized globally as a pioneer and market leader in dental AI diagnostics. We've got Sophie Lovett, Pearl's International Channel Sales Manager, and Ashley King, Head of International Partnerships. Together, they're helping practices around the world move from inconsistent diagnostics to a new data-driven standard of care, one where AI isn't replacing clinicians, but rather assisting them in diagnosis, empowering teams, and enhancing patient education. What I love about Pearl's approach is that their AI doesn't just identify pathologies, it acts as a powerful patient education tool. By turning complex clinical data into visual, explainable insights, it helps dentists communicate with clarity and builds patient confidence like never before. Sophie, Ashley, welcome to the show.
Thank you. Thank you, Dr. Randeep. That was a great introduction.
Thank you for having me.
You're very welcome. Let's start with something personal. What drew each of you into the world of dental AI? So what was that moment when you thought, this is the future of dentistry?
Yeah, I'll start here. So I have a background in dentistry. I actually started my career working for a consumables company. And I randomly got a message on LinkedIn one day for a tech startup that was doing healthcare efficiency with AI. So I started working there in 2021. I thought, this is really cool. I have a background in public health. Always been interested in how we can intersect technology with healthcare. And it was a great experience. But one thing that I learned very quickly is healthcare and hospital systems much slower to adapt in terms of technology. So when I was reached out to by a former colleague that works at Pearl now for this role at Pearl, it was a very easy yes. And it's funny because when I left my initial dentistry job, they said, good luck, you're going to be back in dentistry. And there's like a joke that it's like the Hotel California. Once you check in, you never leave kind of thing. So we're back in dental using AI with it. It's the best place to be in dental, in my opinion. So that's my story, Sophie. Sophie's is also pretty exciting.
So I was thinking about how I got into Pearl recently. And I remembered that one of my first dental events was when I was a teenager. So I went to help out at an awards show there. And so I've always kind of been on the outside looking in. I had my oldest brother work in dentistry. And one of the things with my background in both logistics and finance is that technology has always been at the forefront. So that marriage between technology, healthcare, it's perfect. And for me, Pearl was one of the easiest yeses. It's a fantastic company. It's so innovative. And we're also helping both clinicians and patients, right, with technology.
Yeah, I love both those stories, actually. And I second what Ashley said. I think once you're in dentistry, you're in dentistry. Even if you try and it kind of gets into your blood. And it's one of those things, it's got such a great community behind it as well. So whatever you do in dentistry, I'm coming from like the clinician and then, pivoting out and doing kind of AI and podcasting software. But yeah, I just find that no matter how hard you try it gets into the system. And I think it's a great community to be part of. And I think AI is really exciting in this sector. it's something that we can apply. It has real world application to patients and dentists, and it's really, really exciting there. So in terms of Pearl, you often describe yourself as the dentist's assistant and a patient's friend. Your flagship platform, Second Opinion, it's become synonymous with that mission. Can you take us behind the scenes? What does that look like in a real practice setting?
You kind of touched on it there, Dr. Randeep. We are making something that historically has been very confusing for patients simple. So we have a few different things on our radiologic AI that make it simple for a patient to understand what they're seeing, including the tooth anatomy, which we call tooth parts. And then we also highlight the detections that the AI finds and then the dentist agrees with. And the workflow looks like running the image through Second Opinion. The dentist has a look over it, turns it on, turns it off, sees what they would have maybe saw without the AI, agrees or disagrees with findings, edits what the image shows, and then they show it to the patient. So making this super simple as a patient now, I'm not just seeing like little gray blobs. We've had dentists tell us that X-rays or patients have asked if this is an X-ray of my toes. So I think a lot of times clinicians maybe forget the average person wasn't trained to look at an X-ray. So this is making it super simple for them to understand and also building patient trust. Sophie, I don't know what you would add into that. I know you spent a lot of time in clinics, so I'm sure you have some very good stories to highlight.
One of the most interesting things I heard was when one of the clinicians that we work with told us that she went for an eye test. And for her, it was like a eureka moment. She doesn't do anything to do with eyes. She deals with teeth. So when she saw her eyes and the optician was explaining what was going on, it was, like I said, that eureka moment for her. Because she, like Ashley said, we forget what we don't know. So in that moment, she was kind of brought into the patient's psyche of, when they're sitting here and they're just nodding at us and they're pretending to know what we're talking about. That happens so much, right? We just, mimic that nod. So yeah, with Pearl, we are going back to what I would call school biology. We're explaining it in a really, really simple way that I think is universally understood by patients. And I think if we're paying for something, we want to understand what we're paying for. We don't want to fix it ourselves, but we want to know exactly what's going on so that we can be part of the solution, right?
I think what it is, it's all about patient trust as well. I think when patients can see, what the AI sees, and suddenly the treatment conversations, they change completely because a lot of people are visual. And as I said, patients, they do get confused with x-rays, and dentists, they love explaining things from a technical point of view, but we often sometimes it goes over the patient's head, and you think you've explained something, but they haven't actually got the gist of what you're saying. So I think that showing it color coded like that, and it's a great visual representation. So and I think it all comes down to the patient trust. The patient will trust what you're showing them. They see that the AI's picked this up, and I love the way that, and everybody's concerned about the human in the loop and the AI taking over, but really what you're saying is that the AI is there to highlight this to the clinician, to the patient, and then obviously it's the dentist's job, the clinician's job there to then take over that conversation, and start doing the dentistry from there. So very much a co-pilot or collaborative approach. No, I love that. And the other thing with dental AI companies and Pearl in particular is you're the only FDA cleared company, right? Both for 2D and 3D imaging. Is that correct?
Yeah, so we have some competitors within the US that are approved now for detections. We were the first to be approved for detections on 2D, and now we are the first with 3D. And then as well as internationally, which is what matters most to Sophie and I, because we know we're based here in London and we focus on the international markets. We were the first company to seek MDR approvals and become GDPR compliant, et cetera, so we could go to market internationally.
Fantastic. That's a remarkable milestone. And I mean, what did that journey teach you about building trust, not just with regulators, but with clinicians and patients worldwide?
Yes, this is a really big topic when it comes to AI in general. I was just recommended a book actually by my friend Bex Leon. It's called The Empire of AI. I don't know if you've read it, but I recommend. It's essentially talking about these big LLM companies like OpenAI and really the lack of emphasis on regulation, the lack of emphasis on making sure that it's a trusted tool that we can use, our data is protected, et cetera. So, reasonably so, this is a huge concern for people when they hear the word AI, especially when it comes to healthcare and healthcare data. So, what we've learned is it was worth investing in getting these approvals. It was a huge risk for us because it cost obviously a lot of money to get FDA approvals and MDR, et cetera. We're now approved in over 100 countries worldwide. So that's cost a significant amount of money. It was us betting on ourselves. But you led me into this with this question, which I appreciate. Not only are we seeing the benefits because, patients and clinicians are going to be much more likely to use our tool, and they see hopefully the Pearl name and they know we're good to go when it comes to regulatory compliance and data protection. But in addition, it has helped our brand. We never entered a market and said, well, just figure it out. Good luck. Like, we'll get the approvals later. That's the first thing we do every single time when we have a new product. So it's been really great, I think, for our growth because, we're able to deploy successfully and, no constraints there because of compliance, but also people just like to know that that's the company that cared about that and will continue to do so.
Yeah. And aside from policy and regulation, GDPR, etc., what does it mean further than that? It means that we have been approved. So we've had to prove that we are effective as a tool. And so it's not just about those regulations and approvals, it's about why we've had those, because we're good enough, essentially. It has come with a lot of time, a lot of data, an incredible amount of data has gone into teaching this and is continuing to teach it as well. It's learning, but it's learning in different ways to the ChatGPT. We cannot verify the efficacy of every clinician globally. I'm sure they're all fantastic. But we are very considered with what trains our product. That takes a heck of a lot of time. And I wouldn't want to be starting again with this today. I think that would give me and Ashley quite big heart palpitations. So we've really had the luxury of a lot of time, a lot of data that's gone into this. And as we move forward as well in a highly regulated world, particularly within Europe and the UK, actually it's harder and harder to do this. So I have the utmost respect for any companies that are starting today, particularly when so much data is required insofar as what we're doing, the number of radiographs that's gone into teaching any kind of element of our AI. Regulations, policies, they're far more than just what they are on the tin. They're proof. They're proof of concept.
The trust element goes hand in hand, and I love the way that you phrase it. It was, you bet on yourselves. It was a big upfront cost because, of course, trying to comply with all these regulations, they're very, very costly. But it almost loops back in that if you have that, you get that trust, clinicians trust it, patients trust it, and it's a huge return on investment as well. I mean, Pearl recently closed the largest dental AI funding round in history, right? $58 million.
Yeah, that was our latest
that's
round
huge.
of funding.
I mean,
Series B funding.
Yeah, so what really piques my interest is, that not only validates the mission, but it kind of signals where the entire dental sector is heading next. How does that level of funding and backing influence your innovation pipeline and future direction?
Yeah, it's very exciting. As I mentioned, this is my second startup, so it's always like a roller coaster when you're going through rounds of funding. But yes, you said it right, Dr. Randeep. We closed $58 million in Series B last year. And I think this just speaks to the appetite for AI in dentistry and future technology. Something that we kind of say is we're moving from the digital age in dentistry to the cognitive age. So what that means is 10, 15 years ago, scanners became prolific. Now we believe that AI and, aligning technology will also be prolific. What this allows us to do is go beyond our current product internationally, which is Second Opinion, allow it to be our cornerstone product. So it's surfacing detections and, providing great patient education. Now we can take the data that we're finding there and build out things like auto charting or helping with billing, et cetera. So it's going to be really an investment into allowing the dentist, the clinicians, to get back into why they came into dentistry, which is to provide great patient care. So we're taking away the admin that's allowing or keeping them from doing so.
Yeah, I think that's what I'm hearing from a lot of practice owners and business leaders in the dental space, is that they're quite keen to see how the AI will kind of free up some of the more tedious tasks and free them up to actually do what they love, which is the patient-centered stuff. And I know there's a little bit of a narrative about, AI is going to take over and it's robotic, and how is it going to go hand in hand with the clinical work? But I think what I'm hearing, from my side really is that it's exciting because if the AI does all the stuff efficiently, accurately, and a lot of the tedious stuff, which would take a lot of time, it frees up the people actually to spend more time doing the human-centric stuff and the patient-centered stuff. So I think that the Copilot analogy goes very much hand in hand. And yeah, I would agree. I think that there is a shift really in dentistry where data intelligence now is becoming just as valuable as, I would say, equipment or premises. It's going to be the next thing. And you touched on the Pearl maybe moving into some more of the digital infrastructure that supports the operation side of things. If we now fast forward to 2035, what do you think will look back as the single biggest shift Pearl helped create in dentistry?
Yeah, I think it will be workflow efficiency. So knocking off 10, 15 minutes from an appointment, because now dentists, like you said, aren't doing the tedious things that they hate. And like I said, Second Opinion is kind of the cornerstone product that we'll build off of. But yeah, in 2035, I think we'll look back. It will be like when Uber didn't exist and iPhones. And I kind of think of Second Opinion as the iPhone. The iPhone has come out now, let's say it's 2000, I'm not sure, 2008, maybe around that time. I think I was in 8th grade then. Not to show my age, but I couldn't have anticipated that Uber would exist a couple years later and that I would just be able to order a car to my house. And I think it's going to be the same thing in dentistry. We have these cornerstone products coming out, and we'll continue to have so much more come on the back of those. So the future is bright. Who even knows what it will look like in 2035, but we can certainly make predictions.
Do you know what I think it won't look like, though? I don't think we'll ever remove people from dentistry. I have the fortunate position that I speak with hundreds of practices. I've been into hundreds of different practices. And I ask the clinicians, what's going on? What keeps you busy? What are patients like? How many patients do you have who are nervous patients? There's so many nervous patients, right? We do not ever want to remove that human element. But if we can streamline the practice and make it easier for clinicians, it's a tough job. That's what we want to do. That's our focus. Our focus isn't to take away from the people who make the industry. I believe that Mark Zuckerberg's dad is a dentist. And interestingly enough, the first robotic dentist was apparently made, or the inception was from Mark Zuckerberg's dad. I don't think we ever want a robot dentist because we want to be able to ask a clinician what's going on. We want them to be able to explain. We want there to be empathy within that. I really, really can't see us moving to a world of full automation without humans, particularly in dentistry. Yes, there are other areas where that we may see that shift, particularly with the emergence of AI, but certainly not in dentistry. So whenever we have clinicians join us, every now and then we have those who are a little bit hesitant, reticent to adopt AI. But I'm seeing that actually diminish somewhat because they're understanding that we're here to support, to act as a second opinion. They are always the first and primary decision makers. And I think we've done a pretty good job at Pearl in getting that message across that we're here to work with you and just make sure that that works for the clinic.
I'll even build on that. I was speaking to some friends the other day. We were talking about the emergence of robotics with AI. And, we were like, technically in a restaurant, they could have robot waiters and waitresses, but we all agreed I would rather go to a restaurant with real people, like a real waitress, a real cook, because you really cannot replace the human element. And there's something that humans have that AI doesn't, and that's context. So on top of the level of intelligence that we provide that AI cannot, we also, just as humans, we want other humans to be providing our care. And that, I think you can't change that no matter how far technology develops.
Yeah. You take a look at reviews online, the reviews aren't about the computers. The reviews aren't about the curtains. The reviews are so often about the people.
No, 100%. I was speaking to somebody who's doing AI in real estate, and they're building a tool, and the narrative was, we're going to replace 80% of realtors with these kind of AI agents, and then you'd only need somebody to go open the door. And I said to them, in dentistry, it's different. I think what will happen is that things are so inefficient in dentistry because it's such a traditional industry. And the way the admin burden is, a lot of the clinicians, a lot of the people on the forefront, they don't have that time that they would love to invest in their patients. I see the AI in dentistry as almost being a way to strategically reallocate resources. So, you still have the receptionist, but now that receptionist is going to be infinitely more powerful because they're augmented by 4 or 5 agents doing all the back end stuff. That's then going to allow that receptionist to deal with all the patients in the waiting room and give them that human touch. And yeah, a lot of the stuff I'm hearing as well is people know that there's a place for AI in dentistry and they're excited by it. And I don't think it's going to be about replacing people, and I don't think it should be. I think that's a very short term view. It should be about augmenting the humans in the practice and allowing that team to go so much further. So, the productivity just 10x's, and also hopefully the enjoyment of the work compounds as well, because you're doing the stuff which you actually were trained to do, which is the patient communication and enjoying that side of things as well. So yeah, it's very interesting because there's that narrative that AI is going to cost jobs. I think in dentistry it's not, and I don't think it should, because it's always a people-centered business and a human-centered business. But I think it's going to allow organizations to really become more efficient in how they allocate resources. You're going to stop missing a lot of things. You're going to increase your top line revenue, of course, because you're not missing calls, you're not missing diagnoses on the X-ray, and then the people in the actual surgery, the staff in the surgery, the receptionists, the TCOs, the clinicians. I think they're all going to feel more empowered by this technology because they know that they've only got finite energy. But if you've got the AI there to help you doing all the tedious stuff, you then can go and do the best work that you can. So yeah, I would second that. I think it would be really dystopian for it to take over jobs, and I would think it would be a loss. I think if you went to a dental surgery and you're greeted by like a robotic receptionist and there's nobody there apart from the dentist and maybe one other person, I think a lot will be lost, and I don't think patients would like to go to surgeries like that. So I think we're quite lucky in dentistry because it's not really a profession where the AI will be able to take over, and I don't think people will let it take over. I think they would use it for the best of what it's there for, which is why it's quite exciting, I think, in comparison to other industries there. And the other thing I wanted to touch on really is whenever you have a new technology, there's always skepticism, whether it's over, costs or accuracy, false positives, or just, general fear of change. How does Pearl balance kind of, the accuracy of the AI with the dentist judgment so the human always feels and stays in control?
I think in terms of how clinicians are regulated, they are the first and primary decision makers. So second opinion is a device for detections, not diagnosis. So the final say always sits with the clinician. And I think that we need to ensure that that message is repeated and sticks. So it's not going to be able to replace the clinicians because of that, because they're always going to be the first and primary decision makers there. But we're working with them. Every practice I go into, there's varying degrees of adoption and willingness to adopt, right? So our role is to go into a practice and speak to everybody. We're quite unique in terms of Pearl AI touches everybody from the CFOs, the commercial team, to the receptionist, to the hygienist. Okay, so every single conversation we have has to be tailored to ensure that the people who are working with it are comfortable with it and really understand it. So when we are talking to hygienists, we'll talk it in a different way. And actually, it's really empowering hygienist therapists as well to be part of it. We work with other companies. We like to align with other companies such as Curodont by Vivardis. So Pearl is really highlighting a lot of areas there for opportunity with them. When we're focusing on particular groups within a practice or within a group, I think it makes them feel listened to. And I think that really helps the trust that is built with adopting the product. There's a hierarchy in dentistry that's very, very unique. I think it's kind of within healthcare, right? So we really have to tailor our conversations, ensure that we are speaking the right, we're providing the right message to the right people. So we do a lot. We go into practices to see what's happening, to see the workflow. And I think that really helps the clinicians who are using it adopt it, and trust us fundamentally as well.
Also, Sophie, you made a great point earlier about our regulatory approvals. It's not just the check box. We had to prove that when a dentist uses AI, it helps them be more accurate in their diagnosis. But the truth is, we didn't go in and prove that we could diagnose alone. We are only approved for detections. So I say it's almost like when the GPS came out. The other day I was back in the US and I was driving to my parents' house, and the GPS was like trying to take me on this weird route. I knew one of the roads was really hard to take a left turn on with traffic, so I didn't listen to it. It was a suggestion. And that's what I'm saying to our clinicians when we speak to them. It's a suggestion. It's pointing out a route that you could take or what it thinks, but in the end, you're still driving the car.
Yeah, I love that analogy. I've often done the going around in circles, just following the sat nav. When I actually know where the destination is, but we're so trained to follow the sat nav. So no, I love that analogy. And as practices start exploring AI, I think you touched on this in terms of the kind of leadership there, but leadership really does become just as important as the technology. What advice would you give to a practice owner who wants to introduce AI the right way, ethically, sustainably, and with their team fully on board? Maybe they're on the fence about AI, or they just don't understand the technology at the moment. What would you say to those clinicians who want to adopt it, but they're just not sure at the moment how to go about it?
I think it's very normal to feel concerned. I think we're often scared of what we don't understand. So I would say if you are super concerned about AI in dentistry, educate yourself. I think that's step number one. Then, we have the EU AI Act coming out. That might not apply directly to the UK, but it looks like the UK is going to be implementing the same laws as well. So finding out what is going to be the standard and needed to be compliant with the EU AI Act, and then finding tools that are aligned with that. Oftentimes, it will be advertised on their website if it exists, is what I've learned. So, circling back on what I said, essentially learn all you can about AI if it scares you, because then you're able to protect yourself and your practice. But also, on top of that, I would say it is exciting, and you don't want to be the guy who's using the flip phone when everyone's using the iPhone. So hop on the train, and I think your team will be happy that you did as well.
Dr. Randeep, leadership and adoption is one of the hardest things. And I'm really pleased that you asked this question, because this is one of the toughest things we experience, right, Ashley, to get everybody on board with it. And what we'll do when we're working with a group or when we're working with an individual clinic is we'll try and deep dive and understand their leadership style, not only from what they're doing in terms of being a leader at the moment, but also where we can identify how we can assist with the leadership and therefore adoption. So every group is different, every practice is different. And sometimes we'll have a group that will say, you have to have this, we're switching everything else off, it's enforcing, okay? And we'll go along with that. But of course, then we're talking to the boots on the ground as well. So we're taking that message from the group, from the top of the group, and then we're implementing it in a way that also speaks to the boots on the ground. Or the leadership may need to have advice and consultancy from Pearl, because we have whole teams who are working on leadership to adoption. So we can very much provide a consultative approach and advice on how we have seen other groups effectively implement change. It's hard, but there are lots of lessons to draw from our existing customer base. We have a lot of big groups across Europe and in the US, and there's a lot of guidance that we can provide. I appreciate it's not very specific, but that's because everything is very, very much catered towards, depending on the group, depending on the size, depending on the existing mechanisms they have in place. But it is one of the hardest things that we have to do. And the thing that works most is time. So we have to ensure that we've got the time. We've got the time to be able to be there to help, to assist, and also to reiterate as well. So it's not just here you go, this is how you use it. We will go back in consistently until they are using it. And one of the biggest endorsements that we have at Pearl is the number of associates who've led us into other practices that they work in. So they say it's like having spell check and having spell check taken away when they go into another practice that doesn't have this. Doesn't mean they're getting lazier. It just means that they're working with the AI. And another crazy thing as well is we'll go into practices and we'll see the screens are very different. So we're not working with the same machinery. So if we can provide something that's consistent and is going to improve efficiency and consistency across the board, again, that's really going to help leadership in terms of helping them to drive it as well.
Yeah, I think that's such a valuable insight, because we talk a lot about the tech and the AI and everything on our podcast is obviously tech centered. But what I'm hearing that in real innovation, it comes down to actually the people, not the products. And that's something that's never gonna change, and nor should it. So I think that's a really interesting approach there. When you think about leadership, and I'm talking about leadership now inside Pearl, how do you keep a global team aligned around one vision while you're scaling so fast? I mean, that must be a bit of a juggling act, right?
Yeah, absolutely. I think it's a very common problem for startups in general, and then you bring in the global element, and that makes it difficult. The reason is we have so many different markets with different perceptions of AI and needs, and obviously employees, even cultural differences. But our leadership does a really great job of keeping us all aligned by really bringing us together every month for our meetings, aligning on what we're winning at, what we're losing at, how we're going to proceed differently. And like something that's different about Pearl that compared to other startups that I've worked at is Pearl has a deep trust in the people that it hires. So once they've really banged our mission and vision into your head, they're like, go off into the world and do something great and come back to us and tell us what you've learned. That's a great thing about working for a startup in general, is that your voice is heard much louder, even if you're across the pond in the UK. So they're really allowing each member of our team to make a difference and to come back with what we've learned in our iterations, and then change things internally depending on or what we learned. One of our key fundamental things at Pearl is be an owner. And So this looks like you see a problem that maybe they aren't seeing domestically, and you go back and you fix it because you're almost like a part owner of the company.
And they listen, don't they? I feel like they really listen. If we say something, they trust us. They know we're saying that for a reason. And so if something doesn't work in one area of the world, but it might in another, we can say that and they will listen. And it feels really great to be appreciated by a company because we have such an intelligent and strong leadership. Not only that, but we, in the markets where we are working with, we have, again, boots on the ground in those markets. And that's for a reason. It's very, very tough to really know what goes on behind closed doors in a practice when you're not in that location. And that's why we work with partners globally, so we can really, really understand and feed back to our leadership. We're very, very lucky in the intelligence that we've got there, pal.
Well, that's awesome. I think there's a lot to be said for having that autonomy. If you have that level of autonomy and you know you're going to be listened to, and your feedback matters. And I think it's nice because it is one of the nuances of a startup that you have that structure. And sometimes as things get larger and larger and more complex, the things can change. But I think the autonomy side is good, and having boots on the ground. If you've got people actually there listening to that feedback and having those nuances, and they're passed onto the leadership, I think that's a great structure. I think that overall is a great structure. I mean, it's just been fascinating, these insights, and we're almost coming to the end of our conversation. But one thing I like to do at the end of our conversations is like a quick fire round of questions, which they're really designed to get at the heart of systems level thinking. So kind of see how you tick really in terms of mindset. So I'm gonna go and say a couple of questions, and not to put you on the spot, but the first thing that kind of comes to mind. So the first one really is, what's one belief or mental habit that's helped you stay resilient through disruption?
Everything is an experiment. And the reason I say this, I think oftentimes in failure, we take things very personally. But the most successful people look at new endeavors as an experiment and something to iterate if it fails. If you can take out the personal, being hard on yourself, down bad because you failed, but just say, okay, I learned something here. Let's try this. The quicker you iterate, the more you'll do, the more success you'll see.
Something I say to myself all the time is, if you're not doing it right, you're doing it wrong. It is the most simple phrase, but I always ask myself it. If it's not going right, I'm doing it wrong. Take a different approach. I think sometimes we can get too invested in something to move on. If we tell ourselves that, we can move on, we can do better, we can start fresh.
Sunk cost fallacy.
I love that. And this one, hopefully, is not a little bit too deep, but if you lost everything tomorrow, but you kept your knowledge, what's the first thing that you'd do?
It's a hard one. I would go find a mentor personally. Reason I say that is I think a lot of my success has been due to being surrounded by great people who have more knowledge than me, but also lift me up and believe in me. So number one thing I would do, find a mentor and then start surrounding myself with people that believe in me and want me to win.
It's a really good question because it's so difficult to imagine our lives with nothing that we've got around us, even just the roof over our heads. But yeah, I'll reiterate what Ashley says. And is one of my greatest assets has been the people I know, my personal, internal, external network. So it would be about knowing to surround myself with people, very, very much kind of along the same lines of Ashley there, because it's people who propel us.
Yeah, no, I love those answers, and I would agree. I think mentorship and having the right mentors at the right time, and having people around you who've been there, done that, and they could really guide you. That's a huge asset to have. And this is the final one. So sorry to keep putting you on the spot. Hopefully this one might be a little bit easier to answer. So finish this sentence. The future belongs to those who?
I would say are curious, never stop learning.
I'd say who take incremental steps forward.
Awesome. Sophie, Ashley, thank you both for sharing not just the technology story, but the human one behind it. It's been inspiring to hear how Pearl continues to shape the global AI landscape in dentistry. For our listeners who'd like to learn more, where can they connect with you both?
Yeah, check out our website, hellopearl.com. And then Sophie and I are both on LinkedIn, so give us an ad.
Ashley King, Sophie Lovett. We're here to speak with people. Get in contact with us. We'd love to chat.
Thank you. And that brings us to the end of another fascinating and insightful episode. If you want more amazing content like this, don't forget to follow, like, subscribe, and share. It helps more dental leaders discover conversations like this one. You can reach us on www.techdental.com or drop us an email at info@techdental.com. I'm Dr. Randeep, and this has been the Tech Dental Podcast, exploring the intersection of dentistry, AI, and intelligent business thinking. Until next time, keep innovating, keep learning, and follow along for a disruptive ride into the AI revolution. Scaling a business isn't a dream, it's a decision. This is the Tech Dental Podcast. And if you found value today, follow, share, and subscribe. This is the edge every dental leader needs.